Good morning. Welcome to the Carroll County Commissioners' Open Session for Thursday, May 29th. And as we always prefer to do, we'll start with a Pledge of Allegiance and a moment of silence.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Do we start on the left? Did you start last week?
I think it's me this morning.
Oh, it's
I
you,
do.
okay.
But
Oh, you're right,
Yeah.
I remember, yes,
we're,
because Commissioner Gordon introduced you, yeah.
yeah, well, he took up half of Priority Carroll last week.
Usually it's Commissioner
That's
Bigliotti,
what-
so
that's
once
what I
in a
remember.
while I got to take it up too.
So, Commissioner Garin, can you
sorry.
start us?
I will. I'll
Now
be happy to.
And I did pray for focus, it just didn't work, so
Same
I'm
here.
sorry.
I did too, and it didn't work either. Thanks. Good morning, Carroll County. Just a few quick announcements, and again, my congratulations to all those seniors out there. We're about to hit a very exciting week next week with high school graduations. I know I'll be at South Carroll's as a commissioner, but also as a dad, as my youngest daughter graduates from South Carroll next week. So we're all excited out there. I know the parties are starting. Everybody be safe and be smart. I wanted to mention an event next week. So the Carroll County Public Library, if you go to their website, you'll see they have a lot of events going on at every single regional library every single day. So I hope people can join me this Wednesday on June 4th at Exploration Commons for a author, his name is Brian Hester. He wrote a book entitled She Talks to Fish. He is coming up all the way up from Boone, North Carolina. He is an avid fly fisherman. He's an artist, and now he's an author. People familiar with Western North Carolina know that's some of the oldest rivers in the world there, and it's actually some of the best fly fishing in the world as well. So Brian Hester is coming all the way up from Boone, North Carolina to come to Exploration Commons to talk about his book. Our very own Ted Zaleski, who is an avid book person himself with his podcast, will be interviewing Brian. So again, it's going to take place from 6:30 to 7:30 this Wednesday at Exploration Commons. I hope everybody can join me. There's one of his paintings right there. Again, he's just an incredibly skilled individual, and I really want to thank the Carroll County Public Library for reaching out to him and having him come up to meet with us and experience our county. And we've got a lot of fly fishermen here as well. So if you know anybody who's into the sport, please let them know. Again, June 4th. This coming up Wednesday at Exploration Commons from 6:30 to 7:30. And that's all for me. Thank you.
Thank
Good
you.
morning, Carroll County. I will be taking Commissioner Garin's time this morning since I have a number of things I need to cover. First and foremost, wanted to mention that the Bureau of Facilities and Citizen Services partnered with Girl Scout Junior Troop 1096 on their Bronze Award by creating a project to educate the importance of protecting wildlife from stormwater pollution. The troop presented 3 designs at the Westminster Senior Center for voting, and the examples here were what was selected. Project was completed at the Westminster Senior Center on Saturday, May 24th, and congratulations to all the Girl Scouts involved on receiving their Bronze Award. Last Thursday, I attended the 10th Annual Drug Overdose and Prevention Vigil. As always, a very moving, emotional, and tough event, I guess is the word I'll use this morning. The one positive that I think really stood out, there were a number, but definitely one that stood out, was the fact that according to statistics, overdose deaths have been down from where they were 10 years ago. I know at times it probably doesn't seem that way, but that truly was a positive, and I know a number of people in the room were very appreciative of that information, but always a very good event to turn out for the community, and truly appreciative of everyone that turned out, as well as the State's Attorney's Office for holding that. And again, this was the 10th anniversary, or 10th annual event of this. On Monday, I attended the Memorial Day Parade in Westminster, which is one of the oldest parades in the nation. I had the pleasure of riding in a 1928 Model A, which was quite the experience in its own right, but truly enjoyed that as well. You can go ahead, Chris. Of course, there's me in the Model A. And then yesterday, myself and Commissioner Kyler had the honor of attending the commencement for the community college ceremony. There's me with Lisa Slappy, the Chief Communication Officer for the college. Incredible group. I think it was about 500 graduates this year. They had mentioned some receiving high school diploma, some obviously first family members receiving, higher education. So it was very nice and touching to see all of that and how that plays out in our community and the positive that comes out of that. Also, I'd be remiss if I didn't mention that they awarded 2 Emeritus Awards for 2025. Dave Bollinger, who was recognized for 24 years of service to the college, including 2 terms as the chairman of the Board of Trustees. He was the keynote speaker, and they gave him emeritus status, as well as Timothy League, retiring as Director of Financial Affairs, who received the title of Director of Financial Affairs Emeritus. Under Tim's leadership, the college experienced 27 audit-free years, an unmatched record for financial integrity and excellence. Both obviously leave quite a significant impact on the college. And last but certainly not least, this week I need to mention one other thing that I think some people might be aware of, but probably not as many. Yesterday, Charlotte Lee Hoffman was born. As some may know, that is Mackenzie Hoffman and Chris Hoffman's daughter. So congratulations to them, and obviously the Hoffman family and the DeWeeses are all very happy, and she's good and everybody's happy. So congratulations to them, and that's all for me.
Well, thank you very much. I'll associate myself with the comments made by Commissioners Gordon and Guerin thus far, and I have 2 things to talk about today. So first of all, I had the honor and privilege of speaking at the Memorial Day ceremony in Taneytown on Monday, along with Mayor Christopher Miller, State's Attorney Haven Shoemaker, and Delegate Eric Boucher. I then had the privilege of joining in the Memorial Day Parade, where has now become a tradition. I hop in the back of a truck with Councilman Chris Tillman, and we proceed through the parade in that fashion. And it was very, very well attended. Last year, we were kind of joking around. Last year, we all got rained on. The year before, it was like 90 degrees. And so it was nice to have a very pleasant day. And there are some pictures, and I want to give credit to Haley Engels from the police department and from Lorena Vicari from Parks and Rec for these awesome photographs. It was there's the pickup truck, really, really enjoyable Memorial Day. So in addition, this week I also had the pleasure of attending the Coalition on Aging and Disabilities meeting. They really are a wonderful group and very, very active and committed to serving our community. They're already planning for the annual Aging Your Way Expo, which will be held at the Ag Center on September 10th, and more details about that will be coming out very soon. Interestingly enough, a couple things I picked up during the meeting. Members of the commission are understandably concerned about how reductions in federal and state grants are going to potentially affect the elderly here in Carroll, everything from installation of chairlifts in homes to the cost of assisted living itself. There's also some concern about the dissolving of Partnership for a Healthier Carroll, and who's going to be picking up the initiatives and the resources that are available through that group until it ends. And the members of COAD, through all of their contacts and networking, along with their partnership with the health department and others, the services that are continuing to be provided, they're going to do their best to communicate those to the senior community, that these services are still going to be available. Now, importantly, one of the things that they made a point to talk about yesterday was that, and we all know this, the number of homeless individuals in the county are increasingly those who are middle-aged and elderly, people from their 50s to their 80s. And this is for a number of reasons, including mental health issues, medical costs, the cost of living, among other things. Maryland is now the 5th most expensive state in the country in which to live, and people are looking to our county for an escape. I'm sure everybody saw the article a week or two ago about how home sales in our county were up 10% last month. I bring all of this up because it's important to understand who needs help in our community. And because the nature of who is homeless and the nature of who it is who needs help and why is changing. And this speaks to the heart of our county and what we do. This year we always have a balanced budget, and this year in particular, we've really lived within our means. And that matters because I know that we've heard from some members of our community who've urged us simply to dramatically raise taxes in order to dramatically increase our spending. But this is one of the reasons why there are concerns about raising taxes, because they always hurt those who are most vulnerable. Tax increase may very well be the difference between living in a house and living in a car. And so I do want to, commend my colleagues up here again for the constructive manner that we always approach our budget in, but this year in particular because it has so many far-reaching consequences and ramifications. And that's all for me this morning. Thank you.
Okay. A few things. One is, as shared, graduations start next week, so look forward to attending a couple of them. And congratulations to those graduates from Gateway last night. And I think some graduations have already started in some of the private schools, but look forward to continuing to support our public schools and all their graduations. Attended MACo, Maryland Association of Counties. We had a board meeting with our sponsors, and it was an opportunity for those that sponsor MACo in the winter and the summer conferences. It's an opportunity for them to have one-on-one with the board members to talk about different initiatives and opportunities throughout the year. Also, this is the beginning of the legislative preparation where MACo will end up with 4 or 5 primary initiatives that we as a board want to highlight to legislation that starts in January. So good ideas are starting to come in now. I ask for your good ideas collectively to share them, what legislation you would like to see or or not see in Maryland. And let us carry the water, us being the 5 of us, to our legislators and to MACo to come up with continuing better laws for our community. The 5 of us, nor those in legislation, can come up with those ideas all on their own. We're representatives of you, so your insight, input, candid comments definitely matter. The last thing I want to share is a close friend of mine, along with colleague, mentor of mine, as well as an icon in Maryland and a friend, mentor, and colleague to so many in Maryland, has passed this past week, Dick Story. Dick was 78 years old and has had cancer. His wife, Ginny, along with daughter, Karen, I've become very close with over time. Dick was from Vietnam, after Vietnam, came to Carroll County to WTTR radio and was the voice of WTTR for quite some time. And then in 1979 became the first economic developer here in Carroll County. And was economic developer in Carroll County for some time, and then went over to Howard County for about 20 years and worked at the state and has just, had this smile on his face, and his smile was inside and out. And he will definitely be missed, but those that have known him, if we could just take a piece of what he was able to share and deliver, we are better for knowing him. And may his his memories always be a blessing to those that have known him, his loved ones and friends and colleagues. His funeral is on June 14th, the Army's birthday, which is very fitting for him. It's going to be an incredibly crowded, ceremony, but it will be on YouTube. And so you get the opportunity, even if you don't know the gentleman directly, it's an opportunity to get to know someone and say, that's the type of guy I want to be like. So he is truly missed for all the things he's done, and we are so better because of having him in our lives. And that's where I want to leave it today. Thanks.
I
Thank you.
do have to mention just one thing, if I might. You mentioned a lot of the things Dick Story was involved with. One of the things he also was involved with in Carroll County was scouting. So I had the pleasure to meet him through scouting over the years. But you're absolutely right, Commissioner Rothstein. Quite the individual that left a, I think I could say, indelible mark on a lot of people's lives over the years.
Thank you, guys. And all four of you. I'll start, and then, Chris, whenever you put up info about the petition, I'll talk about that. And there it is. Sally Taylor had contacted me actually this morning, and I've seen the information on Senate Bill 931, the solar bill that they had in Annapolis this year. MACO worked very hard to minimize the damage, but and again, I try to tell people in Annapolis, they don't hear it. Carroll County is not opposed to solar. We have one of the biggest rooftop solars probably in the country, definitely in the state. We have commercial solar. We just feel like solar shouldn't be on ag ground. And this bill, I think, had up to 5% of your agricultural ground, you're supposed to cover it with solar. There's so many creative ways to use solar, not just on rooftops, but there's solar you can farm under. There's solar that are give you almost covered parking on parking lots. There's so many creative ways to do solar. It's depressing for me that so many people that push the community solar and the commercial solar, they want the cheapest way possible. They want it on flat, fertile ag land. This is another assault on local control. The state's saying, doesn't matter what our zoning says. And we're going through it now with a couple of the community ones where they don't want to honor our setbacks. And, you have to, my opinion, in Carroll County, you have to be friendly to your neighbors in the community. I do believe in property rights, but there should be a limit. So on the screen is a website. Farmers Alliance put out this petition, and I apologize. This is the first opportunity to say something about it. I think you need to sign it either today or tomorrow. I think Monday, maybe over the weekend, but Monday I think they have to turn in the first group of signed petitions. So it's kind of an emergency to do it. And I think Senator Reedy has commented on Facebook. I think the farmers have commented on Facebook. Sally Taylor has commented and may or may not call in for public comment at the end of our meeting to tell us more about it. But she's trying to set up in some areas. But at least anybody watching has the website and knows how to go on and sign that petition. So I definitely wanted to bring that up. And We already mentioned the drug overdose vigil, and it's just awesome. I actually got there a little bit late, but I did get to see the lighting of the candles, and it's so many great families and friends that have lost family and friends to drugs, and it's just like Commissioner Gordon said, it's an awesome ceremony. The reason I was late is I went to Career Tech to a certification ceremony, and I've gone to a couple of those over the years. It probably doesn't take an hour, and you see a lot of kids from all the high schools in Carroll County come in there and either learn a trade that they want to pursue, or they get the opportunity to be exposed to something and decide that's not what they want to pursue. Either way, our career in tech is probably, I don't know of anybody else in the state that has something that good in their county. So it's another example of Carroll County Public Schools being rock stars. I also went to Carroll Community College graduation yesterday. That was awesome. It's Commissioner Gordon showed a photo, and they, like our high school graduation ceremonies and McDaniels, they just have everything set up. It flows. It's great. Great kids and great families. And one of the things I mentioned at the community college one, for a lot of the people participating, the people on the stage, some of the faculty there, they've been to a dozen of them. But I said, you got to recognize, be it high school, be it college, there's families there that this is the high point of what their child's done so far in life. And it's a very, very important ceremony for them. And there's different times where some of them get a little exuberant on cheering and yelling and whatever, but you kind of understand it and they maintain control. But it was awesome being at that. And then a couple hours after that, I went to Gateway's graduation. That's another super ceremony. They have this year it was a high of 30 graduates that were there for the ceremony. They had a few more. Typically it's 20, 25, but it was interesting. They decided this year to control the time. At their graduation ceremony, each student gets to ask a teacher, principal, guidance counselor, somebody in the school to come up with them, introduce them, and talk about them. And like a lot of things in life, they always tell them, you can talk for a minute and a half. Some were 3 minutes, some were 5 minutes, some were whatever. So they decided this year with 30, they would do videos ahead of time, limited to 90 seconds, so that the ceremony went smoothly. Not good news, but unfortunately, their art teacher passed away on Monday, and she's been fighting cancer, but looked like she was doing well fighting cancer. So this was a surprise and an unexpected death, and 3 students had picked her to be their speaker. And because they had taped it to control time, they were still able to use her speeches, and it just it added a little bit more sentiment to the graduation ceremony, but it was awful, and I feel for the school and the family and the loss of her. And like I say, and it's awesome that 3 of the 30 wanted her to be their speaker, and there were a couple others with 3. I don't think anybody had more than 3, but it's an awesome ceremony because of they have a small class, so they can be more personal. And like Commissioner Rothstein mentioned, next week's more graduations. I'm going to go to Winters Mill and Man Valley because I have connections at both of them, and it's neat, and it's either the end of a process for a lot of the students, or it's a step to their next world, their job, their military, their college. So it's an awesome ceremony. And I'm done. Thank you very much. And our first item on the agenda is 2 wall-mounted bunk beds for the, probably not the sheriff's personal use, but for the sheriff.
You want to do priority, Carol, after, with economic development after?
I'm sorry.
You want to do economic development after?
Oh, I'm sorry.
Oh, that's all right.
Yeah, I'm sorry.
And we can get out of the way.
Yeah,
I
we
think,
will.
yeah.
We've only got one other
Yeah.
item before
You're good.
Board of Health, so yeah, I'm sorry. I didn't even,
So we want to go with the sheriff, or we're not going to go with the
Good.
Yeah.
We'll go with the sheriff. He's got
Okay.
things, he's got things to do.
sheriff? Yeah.
I know he's
Grandpa?
had a busy weekend.
I
They
had a
have to
busy
take- they have the
weekend and a
table. We
busy
gotta do them.
week, not much sleep.
Yeah,
Yeah.
Mazel tov.
What's going on?
All right. The Office of Procurement, cooperation with Carroll County Sheriff's Office, is requesting your approval to purchase 2 Max Secure wall-mounted bunk beds to be installed in housing units in the detention center. This is a sole source purchase in the amount of $29,938.86 for purchase and installation. This amount is approved in the fiscal year 25 budget. No additional funds should be required.
Good morning, Commissioners. I have some additional comments for you. So these specific types of bunk beds are used in certain areas of the facility. They're not used throughout the jail. It depends on the need. We do go through and look to the requirements to research what's available so we can put the correct equipment in the spaces that we need. So the focus is on safety and security to both the correctional deputy and the incarcerated individual, no matter where they are in the facility. So these aren't your typical beds that you and I have at home. They're very different. They are specifically designed for correctional facilities, and they provide different features. And you see in the background, I'll explain a few of them in a second. They just provide a safer environment, and also the goal is to reduce the possibility of self-harm and contraband concealment as some of the examples when we look for this type of equipment. As James mentioned, the cost includes the purchase and installation, and also covers a 10-year warranty. It's very specific. They have to come in and actually measure to make sure the correct size, where it's going to go, so that we have a good quote for that. And some of the materials for some of this is it's completely sealed around the perimeter. The way it's attached is very important. It eliminates the access for concealment. There's no gaps or anything. There's no hardware that's actually showing that someone could injure themselves. There's no gaps. And then the way it's designed, it eliminates the risk of inmates using the furniture to try to inflict personal injury.
So Mrs. McDonald is always very politically correct, and I will tell you that these bunks are going in high-risk areas where we know that in the past where inmates have used the bunk beds. Think about this, the building's 55 years old. It's been built in different stages over a 55-year period, I believe. Initially, the bunks were built almost anchored into the wall. Well, actually, they were anchored into the wall. So I think a handful of years ago, I had one actually disengage from the wall, and it fell on top of an inmate that was underneath of it, causing some serious injury. So through time, we've also noticed that inmates will use bunk beds to hide contraband, to hurt themselves, harm themselves, and you can imagine what they'll do there, and also disengage the bunk beds and use them as weapons against the deputies. And so over the years, in these specific areas where this has happened, and it doesn't happen in all of the jail, but the high-risk areas is where we've concentrated on replacing these particular beds so that none of that can happen. And these are expensive beds, make no mistake about it. And this is one of the only companies right now that we can get these beds from that makes them. So this is why we're here, needing those to be replaced. And the beds that are being replaced in that high security part of the jail are anchored into the wall. They're not freestanding beds that are anchored to the floor. These are actually the oldest ones that we have in the facility. So
And we're in the process of a 3-year plan, so this is year 2 of year 3 that we're doing this.
And I think you guys have explained it very, very well. But if we could do one more step so people understand, both your department looks around and tries to make sure we don't spend a penny more of taxpayer dollars than we have to, and procurement does the same thing. Could you just touch on, and you kind of alluded to it, what exactly a sole source purchase is? Because that makes it a little bit harder.
Yeah, so a sole source purchase is going to buy a product or a service that the company, they are the only ones that do it. Whereas like a single source, there's other companies that do it, but we don't have access to it. So we work with places now that are like authorized distributors. They're for us, they're considered a single source because we can't go anywhere else to get it, even though that product is available other places. That's a single source, but whereas the sole source is, that company has that niche. They have patent, something, that makes them very unique to the rest of the market.
So we did a lot of work on this one, going back to look if any other companies had anything new. Keep in mind, we've been working with this company in the past, and we've been satisfied with what they do. So while there are other bunk beds, some bolt to floors, some are freestanding, it all depends on what the need is and what the use is. Others are bolted, so you have hardware, you have brackets, things like that. So this specific one doesn't have any of that. And so that is the company that offers that solution for us.
And Commissioner, I don't like the price of them any more than anybody else does, but, I am solely responsible for the health, safety, and welfare of every inmate and deputy and even the contractors that walk in and out of that jail. And beds over the years have been used as weapons and storage of contraband and a number of other things. So as we evolve, we look at these things, and really this is one of the best beds on the market that keeps the deputies and the inmate and anybody else that has any contact with them safe and keeps any contraband out of the jail. And again, we're not replacing every single bed in the jail. Would I if I could? I probably would, because these are very good beds. But the need isn't there. These are high-risk areas that we know that beds are being used to store contraband, harm people, harm themselves.
And so it's not that they're fancy beds in and of themselves. These beds cost what they cost because of the function that they need to fulfill.
Yeah, there's nothing fancy about them. I mean, it's not, you wouldn't put it in your house to have your kids sleep in it. It's just a very safe, it's designed for jails for this particular reason that we're explaining. And they have the corner on the market. I would love for a number of other companies to jump into it. Doesn't mean it'll be any better, but it gives us options to look at. And we did a lot of research on these, and we have them in the jail now, and so they're working wonderfully, and that's why we're back looking to replace on this 3-year schedule.
Motion to approve the purchase of 2 MaxSecure wall-mounted bunk beds from MaxSecure Systems Incorporated in the amount of $29,938.86.
Second.
Any further questions, discussion? All those in favor?
Aye.
Opposed? Thank you.
Thank you.
Thank you.
I have a few hundred photos of my new grandbaby, if you guys
Oh,
want
yeah.
through and look at them. But
Yes, congratulations.
Congratulations, Grandpa.
thank you. I'm now wearing slip-on shoes, so the grandpa world.
And
She was
the
born 2
good
days
news
ago,
is,
yeah.
it kept your daughter off the road, because I was scared to death she'd pull me over and nail me,
She's
so.
a worker, so yeah, you should have been scared. She'll be back on the road, fear not.
Oh, I know, it's only breeze.
Charlotte. Charlotte Lee, and we will call her Charlie. So there's a reason behind that, but thank you guys. I appreciate it.
Congratulations, Jim.
Congratulations.
Now I need to apologize to Economic Development. It's big red ink right on the agenda, and you two were sitting right there.
Right there,
and-
that's right,
And,
right there.
and worst case, and we should go off air for a second, but I need to thank Commissioner Rothstein for breaking me loose here. So thank you, sir.
Good morning, Denise Beaver, Director of Economic Development, and I'm here with Diana Hare, who's our Agriculture Development Specialist. And we're really excited to announce and talk to you about the 2025. It's the inaugural, the very first Agritourism Passport Program. You each have a little passport in front of you, and we also have posters to give to the sites who are going to be participating in this program. And I said it's the very first, and it was an idea that was brought to us by one of the venues, and we thought, wow, what a great idea. So Diana has been working very hard over the last couple months to make it a reality, and today and tomorrow we're going to be out delivering all of the passports to the sites. We have 21 sites throughout the county, and we'll be delivering the passports as well as the posters. So Diana can tell you a little bit more about it.
It's also my thunder. Good morning, commissioners.
Good morning.
So your passport to summer fun is as easy as visit, stamp, repeat there's 21 participating farms, agribusinesses, and agricultural events throughout the county. Everyone is encouraged to participate. We just ask that you limit it to one passport per group, family, or individual. If you visit up to 10, or you can visit all of them, different locations and get a stamp, and you can then turn in that completed passport to either the library, any Carroll County Public Library branch, or the visitor center, and we'll be giving participation prizes and then holding a drawing for a grand prize in November. So the program runs June through the end of October. We do ask that you check out the hours of operation, any rules or regulations, and make reservations where needed before you visit a particular location. And they are typically marked on the passports if they require something like that. Do you guys have any questions?
Now, this is really awesome, and I noticed that in the back of the passport, there's a little section for an essay. What were your top 3 favorite locations and why? And so with the essay, do you get extra credit for the essay if you complete the essay?
No, I don't. No extra credit, although I think we were just talking about this earlier. I think it's going to be really interesting. I hope people do fill that out because that will be wonderful information for us to share and, sentiments that we can use and find out, who likes which venues best. We're also going to try to track with the venues their participation, obviously, like, did it increase, traffic to their facility? Were their visits up from last year? And, what did they feel about it? So we hope it's going to be something that we'll be able to continue and possibly expand. All of these places are great, and I really encourage everybody to participate, including each of you.
And I think the other really cool thing about this, too, is that a lot of our citizens don't know that, these are working farms, but you can also visit them as well. It's not like it's somebody's farm and you can't ever go and see what they're up to. But the fact that, all of these, all of these places are willing and open to host people is really awesome.
That's true.
Any other questions or comments? Mr. Ross, are you going to make a comment and kind of bail me out for skipping them, or what?
I'm looking forward to it, that's all.
Yes, and if you visit, please take a photo and share it with us, and then we can share that as well. So, and we would encourage anybody that visits the farms to do that. I think that's one way that we can all help to, spread the word about these great places.
One last quick question. So if I have a farm and I'm interested in getting into this next year, what do I have to do?
Just contact me.
Contact Diana.
She's the boss.
She's the boss.
Thank you. Awesome program.
Thank you.
Thank you very much. Thank you.
Okay, now I think I'm back in the right order. We need a motion to recess our open session.
So moved.
Second.
I have a motion, a second. All those in favor?
Aye.
And then we need a motion to convene the Board of Health.
So moved.
Second.
And all those in favor?
Aye.
Opposed? Thank you. Sounds like we're all in favor of you coming up to the table.
Thank goodness.
Good morning to all of you. How are you today?
Very good morning. I have to ask Commissioner Gordon something. Did your arm get tired of waving in the parade?
It did a little bit. I kind of needed some
My
shoulder
grandchildren rode in
exercises.
the parade, and
Yes.
I said to my grandson, I thought they'd be really excited. He said, my arm's really tired. He's 5. I was like, oh,
To
okay.
pace himself.
Yes.
He has to learn to pace.
Well, good morning. We're here for the Board of Health meeting. This time of year, we have a lot of data to share because a lot of the reports come in and a lot of data. Amy is our epidemiologist. Maggie is our PIO, our health strategist at the health department. She's been working on her strategic planning, so we'd like to start with that information. I would like to start with an apology. I did ask earlier if you'd like to meet the acting or interim medical director, and he's unavailable. He is actually full-time, works at the Office of Healthcare Quality. He had another meeting at this time, so I'll be setting that up. I've alerted both Commissioner Kyler and Roberta that I'll be working on a time for us to do that virtually, probably. So I'm going to let these two ladies take over. And present the information.
Before they take over, so this is Board of Health, Health Department meeting with the commissioners. We do it twice a year.
A minimum, yes.
Yeah,
Those
a
are
minimum,
required.
yes, there
If
you
there's
go.
other things going on in the past, we've had issues where we've come here to enact ordinances against SPICE. We've come to do nuisance waivers. Yeah, if we wanted to talk about our fees for environmental health, we wouldn't have to do it we would do it at a Board of Health, but it wouldn't have to be in May or October. For some reason, we were doing them in November, and I don't know why, but I read the statute and it says May and October, so we have corrected that.
And we try to meet with at least you on a monthly basis just to get updates and talk about what's going on. So, important meeting, so.
Yep, and we have some good data, and we have, we're going to request your input on our strategic planning efforts based on the data and where we're going.
Exactly.
I don't know who's starting.
I
so-
don't do, I click on, okay.
Good morning.
Morning.
Let's see.
So I am here to summarize for you the 2025 County Health Rankings and Roadmaps Report. This is an annual report put out every March. This group evaluates the health of almost every county in the nation, and then they use 29 metrics to create this kind of health snapshot for every county. So this has been a really great resource for us. So we'll just start off with the overall data with a couple of maps. So this map shows every county in the country, almost every county. And then there's a key at the bottom, which indicates that the greener the area, the healthier the county. So you can see in the Mid-Atlantic area, mostly green. So we are fortunate to live in a relatively healthy area of the country. And now moving on to Maryland. Again, the greener the area, the healthier the county. So here in Maryland, with the exception of Baltimore City and maybe a couple of other counties, we're doing really well. The healthiest counties, that darkest green area, are Frederick County, Howard County, and Montgomery County. So Carroll wasn't quite the top tier, but we are in the second tier, which is pretty good. Okay, so this report focuses on two types of metrics. We've got population health and well-being and community conditions. The population health and well-being metrics, there's a total of 5 of them. They look at length of life and quality of life. Then they placed us on this continuum with all the other counties in Maryland. You see Carroll County is that labeled circle there. And I will just read the summary here. Carroll County is faring slightly better than the average county in Maryland for population health and well-being, and better than the average county in the nation. All right, so now we're getting into the data. This might look like a lot, and you've got the data you can review at your convenience, but I just wanted to orient you and highlight a handful of these metrics. So I've listed the 5 metrics in the leftmost column. We're looking at premature death, poor or fair health, poor physical health days, poor mental health days, and low birth weight. And then across the report, we've got several years of Carroll County data, starting with 2020 through the most recent report, 2025, which is bolded. And then we can compare the 2025 Carroll data to 2025 Maryland data and 2025 national data. So we'll just go through one of these metrics. We'll look at the poor or fair health metric. which is the second one listed there. This is the percent of adults reporting fair or poor health. This comes from a national survey in which respondents were asked to rate their health. They had 5 choices: excellent, very good, good, fair, or poor. So this number is the percentage that responded fair or poor. In 2020, we were at 11%. Unfortunately, it's a little bit higher in this most recent report, 13% in 2025, but that is lower than the 15% statewide and 17% nationwide.
Does that have to do in part with our aging population?
That is, actually, this is age-adjusted metrics, so they do control for that.
Okay, thank you.
Okay, so moving on to the second part of the report, the community condition metrics. These are social determinants of health. There's a total of 24 of these metrics, and they're divided into 3 areas: health infrastructure, physical environment, and social and economic factors. And again, they placed us on this continuum, and again, we are higher than the national average and higher than the state average. Okay, so this is the first of 3 pages of the community conditions data, this one focusing on health infrastructure metrics. So we're looking at things like the number of uninsured, the number of providers in the county, mammography screening, and so on. And I wanted to direct your attention to the second metric, primary care physicians. This is the ratio of population to primary care physicians in the county. In 2020, the ratio was 2,120 to 1. So this means there is 1 provider per 2,120 people. So ideally, we would want that number to be as small as possible. Unfortunately, it has increased a bit over the years. Most recently, the ratio was 2,260 to 1. We'll also take a look at mammography screening. You're good. So unlike primary care physicians, this is a metric which has improved for us over time. In 2020, we were at 44%, most recently at 49%. And we'll move on to the physical environment metrics. So here we're concerned with air pollution, drinking water, housing problems, long commutes, and they added 2 new metrics this past year, broadband access and library access. So looking at the topmost metric, air pollution, this is defined as the average daily density of fine particulate matter in micrograms per cubic meter. We've improved over the past several years. We were at 10.5, most recently at 7.9. Also, I wanted to highlight the long commute while driving alone. This is defined as of workers who commute in their car alone, the percent that commute more than 30 minutes each way. So this has pretty consistently been at about 58% for the past several years. And that is higher, worse than the state and the nation. You know, we're well aware of this. This is nothing new. We know that Carroll County residents have long commutes. But this is a metric of concern because long commutes are associated with obesity, other physical health problems, poor mental health, and so on. Okay. And our last page of data, these are the social and economic factors. So education, unemployment, children in poverty, things like that. We're generally very strong on social and economic metrics. High school completion, which is the topmost metric, in 2025, 95% of adults here, 25 and older, reported having a high school diploma or its equivalent. And that is higher than the Maryland 91% and the country's 89%. And the last metric I wanted to highlight is social associations, which is third from the bottom. This is the number of membership associations per 10,000 population. So here they're counting anything, all sorts of organizations, political organizations, sports organizations, fitness centers, golf clubs, anywhere where there's a social component. And in 2025, or the 2025 report, we were at 9.6 per 10,000, which is good. All right. Okay. So in reviewing all of this data, this group identified strengths and weaknesses for every county. Here in Carroll, we have a lot of areas of strength. We've got the percent uninsured, severe housing problems, some college, high school completion, the percent unemployment, income inequality, and the percent of children in poverty. Those are all areas of relative strength for us. And they really just identified one area of weakness, and that is the long commute while driving alone that we discussed. They also looked at trends over time. So a number of encouraging trends were identified for Carroll. We've improved in flu vaccinations, preventable hospital stays, mammography screening, percent uninsured, and air pollution. And we've got that one concerning trend, the number of primary care physicians in the county. And then we've got data sources for every metric listed in the report. And that is what I have. Like I said, this has been a really valuable resource for us. Unfortunately, it might be the last report they released. They did lose their funding. They are searching for additional funding, but have not announced anything yet. So this might be it. Hopefully that wasn't too much, but we're just getting started. Maggie has a lot more data to come.
Any questions for Amy before I get started?
Who's they?
This is the county health rankings and roadmaps. It's a program of the University of Wisconsin Population Health Institute.
So the funding is federal to University of Wisconsin, or
Funding is the Robert Wood Foundation, and I don't know much more about them than
they're in New Jersey, so.
yeah.
it's a
So
medical school in
they
New
have
Jersey.
been their primary funder for a number of years now,
Okay.
and I think they might be funded through next year.
Okay.
Not quite sure.
All right, so now it's my turn. So Amy gave you a snapshot of data. I have several snapshots for you, enough to fill a small photo album for those of us who remember what photo albums are. So I promise not to spend too much time on any one slide. In fact, we'll even skip a few. But I just wanted to give you a sense of the data that we're reviewing as part of our strategic planning process. It's pretty extensive data because, as you know, we offer a lot of different programs and services, and we serve all of Carroll County. And we are not concerned just about healthcare, but of other things that impact your health as well. So it's a pretty extensive data set. As I said, we won't spend a lot of time on each slide. I'll just hit some highlights, skip some of the maps, but feel free to stop me if you have any topics of interest. We provided this to you before in case you had a few minutes to look at it. So do feel free to stop me if there's something that you want to talk more about. We're here today. Our goal is to give you an overview of this data and to get your feedback on what you feel is most important in our county and for your constituents so we can incorporate it into our strategic planning process as we set our priorities. So to start out, I wanted to give you an idea of the other plans that impact our strategic planning process. The Community Health Needs Assessment, as you know, is a county assessment that was completed in 2024. The Local Health Improvement Plan is a plan done by the Health Department with our community partners that was completed in 2022 and is due to be updated. And the State Health Improvement Plan is of course, state plan done by the Maryland Department of Health that was completed this year. And as you can see, the areas of overlap are those chronic diseases, diabetes, cancer and heart health, and mental health, including suicide. And then you can see some other priorities and some other plans that we also consider as part of our planning process. And embedded in all of our plans are both health equity, which we consider as giving everybody in the county a fair and just opportunity to live their healthiest life, and social determinants of health, which we'll talk more about. And the other thing I want to draw your attention to on this slide is this cute little ship on the side that stands for the state health improvement priorities. And so you'll see those on some of the slides. That's why I included some of that information, because it is covered in the state plan. And this is just, as you well know, there are several different bodies that impact our work, including yourselves as the Board of Health and the Carroll County government, the Maryland Department of Health, the CDC, Maryland government, among others. You are very familiar, I'm sure, with demographics and socioeconomic indicators of Carroll County. We've talked about them, but I'll just highlight a couple. As Commissioner Vigliotti said earlier, we do have an older population, so you can see here our percentage of 65 plus is higher than the state average. We're becoming a little bit more diverse over time. We do have a great high school graduation rate, a very low unemployment rate, low rate of no health insurance, so a lot of good socioeconomic indicators, which we'll continue to talk about. In the community health needs assessment, there, in addition to healthcare factors, there are these social determinants of health and barriers to care. And so these are some of the barriers I'm sure you're familiar with as well that were indicated in the community health needs assessment. They include transportation, economic concerns, access to services, and mental health services. So we'll talk a little bit about most of those just very briefly, skipping over that. This is another way of looking at that commute that Amy mentioned earlier. We have a high percentage of the workforce that drives alone to work, and as she explained, that can impact folks' both physical and mental health. Economic concerns. You've probably all heard of the ALICE report by the United Way. And these are households that earn that earn more than the federal poverty level, but less than the basic cost of living. And because the cost of living is relatively high in Carroll County, we have a pretty good sized percentage of households who are classified as ALICE. So only 7% of households below the poverty level, but 25% of Carroll County households classified as ALICE. In 2022, also our food insecurity rate was 11.4%, which is near the state rate of 12.2%. Food insecurity means when folks have limited or uncertain access to enough food to live a healthy life. And over 60% of those food insecure individuals didn't qualify for SNAP benefits. That's the second highest in the state. So this is all by way of saying that we have a significant number of families in Carroll who earn too much to qualify for benefits, but don't earn enough to pay for everything they need because the cost of living in Carroll is relatively high. So that's just a group that we want to keep an eye on and make sure we're reaching them. And some of these populations are in specific areas of the county, as I'm sure you're aware, so we keep that in mind as well. So a census tract in Westminster, Union Bridge, which has a higher poverty rate, and in Taneytown. So these are areas that have higher poverty rates, higher rates of ALICE households, higher food insecurity. And one of the things we are working on is a new project with a Care First grant with the Westminster Rescue Mission to reach people in these areas with nutrition education, a little bite-sized nutrition education to meet their needs where they are. I'll skip over that. As Amy said, we're doing well, though, with access to healthcare coverage and ability to see a healthcare provider. However, again, I'll just highlight these statistics that Carroll County has fewer dentists, primary care doctors, and mental health providers per person than the Maryland average. So that just makes it a little bit more difficult for us to access those folks, especially if you have transportation. Go ahead, yes, of course.
I didn't want to stop you when you went on the
On a
next
roll.
slide. So the previous slide about the higher burden, lower resource communities. Are you partnering or working with Ed Singer and the
Yes.
the Enough Act?
Yes.
Okay, all right, perfect.
Yes,
Perfect.
Actually, Amy went and did a presentation of a lot of this data for them, so that they had it, because we're trying to make use of all the resources that we have, make sure everybody has access to the information we have.
yes, we're trying to complement each other, not overlap too much, but.
Wanted to make sure. Perfect. Thank you
Yes.
very much.
Thank you. I always appreciate hearing about what else is going on. So moving on from this, housing, of course, as we know, is relatively expensive, and there's less affordable housing available in Carroll County, which can also be an impact on economics. Moving on to environmental health.
Have you,
Yes, go ahead.
affordable housing, how is affordable housing defined in your?
So there are lots of different metrics that, right, of course, look at affordable housing. This one in particular is the percentage of housing units sold that are affordable on the median teacher salary. And I think they use just a median. So we always are just consistently a little bit higher. So you could see that Carroll has fewer housing units that are affordable on a median teacher salary. I can't say mean and median. I have to say that correctly when I'm sitting next to Amy. So environmental health, I'm sure you're all aware, radon is definitely a concern in Carroll County and in several other parts of the state. You can see that we're all red, which is the highest level of radon in the county, and the blue circles are for the number of measurements, so that just kind of indicates where there have been a lot of measurements taken. And radon is the #1 cause of lung cancer in non-smokers, so it's definitely something that we want to be aware of. We want to make sure that people are aware of and taking the time to test and abate if needed. And the State Health Department provides a lot of data to help us with this metric, and this is just another map that they provided about the radon lung cancer risk by zip code. Moving on to another favorite topic in environmental health, rabies. So as you know, often under my little team, we put out press releases when there's a rabid animal issue in the county, an animal that may have exposed people or other animals to the rabies virus, which is of course deadly. Just as a reminder to everybody listening, when we test for rabies and when we find an animal is positive for rabies, that means the animal is deceased or has been euthanized because they can't be tested for rabies if they're alive. So once we've reported that, we're just looking at previous encounters with that animal. And doing risk assessments on people. So this is a tiny, tiny graph, but what I wanted to mention was that the two types of animals that are most commonly found to be positive for rabies in Maryland are raccoons, by a long shot, as if you can see, by 216 over that 22-year period, and then the next is bats at 44. Carroll County has some interesting stats. We put this together from the MDH reports, and we also have the most raccoons. This is over the past 5 years. The next most tied at second are foxes and skunks, and then cats. And then we've had a couple of positive bats, a positive cow, and a positive goat.
Wow, interesting.
Yes. Very interesting. That's not super common, so we definitely just want to make people aware that if they have to be careful around wildlife, to be careful around unknown or stray animals. If they have some kind of encounter where they feel like they've broken the skin, they've been scratched or bitten, they've come in contact with an animal's saliva, or an animal is just acting strangely, that they can contact us, contact animal control, and get more information about what to do about it. All right, so keeping you on your toes, moving to something entirely different, on to life expectancy. So life expectancy is pretty similar in Maryland and Carroll for all races, but as you can tell, for non-Hispanic blacks in both Maryland and Carroll, it is consistently lower. Causes of death, we are pretty similar to Maryland, and heart disease being the top cause of death, but as you can see, the line for cancer is higher in Carroll, so we see a higher percentage of deaths from cancer in Carroll than in Maryland, but we see a lower rate of deaths from stroke. Another factor in which we're consistently higher than Maryland is in falls, emergency visits for falls, so serious falls with injuries. We were looking at this to see if that was entirely related to the aging population in Carroll County, but you can see, though there are certainly a large number of falls at the bottom of this graph, in older adults, there are also a number of serious falls and accidents in children.
And when you talk about falls, you're talking about like falling at home or something versus, say, falling off a ladder or a piece of farm equipment.
I think it's really all falls.
Okay.
Yeah, all falls. Yeah, so it could be also related to some of those equipment injuries. So anything that's serious enough to bring somebody to the emergency department. So violence I included because it's a SHIP priority, but not surprisingly, our violent crime rate is much lower than the state. We did report an average of 10 firearm-related suicides, 1.5 firearm-related homicides, and 10 ED visits for firearm injuries per year during 2012 to 2023. Physical activity, we are lower than the state in terms of the population with adequate access to locations for physical activity, so sidewalks, parks, things like that. We have a lot of great facilities, but not everybody in rural areas has easy access to those. And then we are higher in reports, in adults reporting no leisure time physical activity. So that may be related to that, the commuting we've talked about before. A little more chronic disease data related to SHIP again. Adults, we score better on diabetes and high blood pressure with fewer adults diagnosed with those conditions, but we have slightly lower rates of screening for lung cancer and screening for colorectal cancer. So these are all, things that can be action items for us. This is just a report of chronic conditions in emergency department visits. So we just have a lot of hypertension. That seems to be something we've seen for the last several years. And I do want to call your attention to this graph, even though it has a lot, or this chart, because it has a lot of numbers on it, but I highlighted the areas of higher burden, and you see again that some of our areas in the west, Tawnytown, Union Bridge, and Kemar have slightly lower incomes and slightly higher rates of obesity, diabetes, hypertension, and stroke. That's often coupled with lower access to health insurance and fewer routine checkups in the last year. So these are just areas that we're looking at to make sure that that we're considering them when planning programs and trying to meet needs and outreaching to communities. So these are communicable diseases or infectious diseases, since we run the gamut of different kinds of diseases. Our top is chlamydia, which is, of course, a sexually transmitted infection. Our second most common is Lyme disease, which is, of course, a tick-borne disease. And the next graph, you'll see that we are consistently higher than the state in our rates of Lyme disease. So that is definitely a concern of ours moving forward, and has been. I'm just going to skip over that one. Top cancers diagnosed in Carroll County in 2022. You can see prostate, breast, lung cancer, melanoma, and colorectal cancer were the top 5 diagnosed in Carroll. Then in terms of cancers that caused death, so these cancer death rates, our highest is lung cancer, and you can see that we stick out a little bit above and beyond the Maryland rate. So we definitely have a higher rate of deaths from lung cancer in Carroll County. And then we have also at the bottom, I'll draw your attention to melanoma, where we also have a fairly, a much higher rate of melanoma deaths than the state. Next, we have maternal health, infant health priorities, in which we're doing fairly well with lower rates of preterm birth and lower birth weight. This is also a SHIP priority. And then moving on to behavioral health, we talked to you a lot about behavioral health. I know it's important to all of us, and as you saw, it also ranks very high in our plans and concerns. These are all areas where Carroll is looking a little worse, and we need to pay attention. High school students bullied on school property, high school students electronically bullied in the past year were higher than the state. Also higher in adults reporting any poor mental health days in the past month and reporting diagnosis with depressive disorders. However, we do see lower rates of ED visits for behavioral health, and this could be in part, this is work we've been doing for a long time to try to direct people to other resources. So this may be as a result of some of that, but this is also a SHIP priority, so we continue to monitor that. Middle school students, many of the next several slides draw from the data from the Youth Behavior Risk Survey, which is that survey that's given to middle schoolers and high schoolers. It is an opt-out survey, but we do appreciate when kids are able to take it, because it does give us really valuable information about our county's kids that we want to know. So you can see some relatively alarming high rates of some of these things in both middle and high school students. The pattern is fairly similar, feeling sad or hopeless. Over 20% ever seriously thought about killing themselves, over 15% made a plan, and 8% tried to kill themselves, and over 25% report their mental health is most of the time or always not good.
You said this is a opt-out survey?
Yes.
Do you have the metrics on how many took the
Opt in and
survey
opt out.
compared to those that did
I tried to find
not?
that, but it was not, I could not find that data. Yeah, it's a,
Well, why is it an opt-out survey?
either the parent or the student can opt out of taking the whole survey. Nothing is required, it's all voluntary. And also, if a student does take this survey, they can opt out of answering any particular question they don't feel comfortable answering. So we can only do the best with the data that we receive, and hopefully increase the opt-in rates in the future.
I mean, one of the significant issues we have is resourcing mental health. And it's very difficult to identify the needed resources if we don't have accurate numbers. Yeah, I mean, we don't do ourselves any favors if we don't promote these surveys well enough. I mean, we're limited on the resources as we know it, you know, especially when it comes to psychiatry and behavioral health. Yeah, it's difficult. I mean, I know it's difficult. I mean, it's just, you know, these kids don't have a year to wait to go see a psychiatrist, you know, and figure out medication. But unfortunately, that's the situation we're living in, and we got to do something about it. I mean, if there is a priority in all of this, you know, it's how do we connect our schools and CCPS, you know, where the largest number of children are, you know, for them to promote these type of surveys and, you know, to help identify the county and state resources needed. I mean, there's a hypothesis there, and you know, it's an unequal or unobtainable solution if we don't have accurate numbers.
It highlights the importance of the work that you all are doing on reducing stigma, and that the state is doing on trying to reduce stigma, because a lot of people don't participate because they don't want their child associated, or they don't want people to know that there are issues.
I agree, but I don't think we're doing a lot to reducing the stigma. I mean, I think there's so much more that can be done, and we're still not, I mean, we're just scratching the surface of this. And these kids are so vulnerable because they are living in a, you know, a concerned environment because they're not identified. They're just there. And it's in middle school, it's in high school, it's in elementary school, it's after high school, you know, and it just continues, and it becomes more severe. I would, again, hypothetically thinking through this, it becomes more severe the less it's treated, you know, and somebody graduates and moves on because they then become more resourceful with, you know, other opportunities that can either self-harm or harm others. Yeah, I mean, if we can help message this, and it's not, you know, just having this conversation. It's not, and I've said this a lot, it's not from the dais, but it's, if we can figure out a way to message this, you know, to the community, you know, and get kids not to opt out. I mean, this, I don't know, we've come a long ways in so many things, but I feel like we are turning a blind eye to mental health and behavioral health by this opt-out type of a scenario, so.
Well, I would have to agree with you, Commissioner Rothstein. I mean, just out of curiosity, with the surveys that they can opt out of, are these, I assume they're anonymous?
Oh, yes, yeah.
So I guess, you know, to your point, is there a better way to package this and try to promote this to the public? I know a number of years ago, Carroll County was one of the highest for suicide in the state, so clearly we have that concern and challenge. And obviously, when it comes to mental health, you know, there's not enough places for individuals to go to get treatment. So obviously, it's not just Carroll County; it's statewide. It's also nationally. But how do we combat that? So I couldn't agree more with you on those thoughts. I mean, I know not to go off too far off of this morning, but obviously, you know, we live in a world now where social media has massive implications on kids, be it, you know, they don't get enough likes on their photos, so that causes them to have challenges and issues because of their age and so forth and so on. And that's not taking a shot at social media, but clearly we have to be better at looking out for not only the youth, but also the adults, because, you know, I think we see it with youth and then it transfers over to the adults as well. I mean, that's one of the factors with a number of individuals I spoke to at the drug vigil. They don't have access. They didn't think anybody cared or was concerned with their mental health state. So then we see that becoming a challenge as well. And how do we kind of approach both of those at the same time? So I would agree. We got to figure a better way to approach this without question.
So I think the task is this is a great report, lots of information. Yes, we know it's data overload because we're not going to comprehend and keep all this. And I'm going to file it, afterwards and never see it again. That's just the reality. But if we can figure out, okay, how do we focus on this? We can't boil the ocean. We're not allowed. God doesn't give us those tools, but He does give us the tools to narrow the focus, and we could boil the puddle, and we can focus on Carroll County and focus on the vulnerable and say, okay, what are the resources? When do we know enough is enough? When do we know when we've hit success in having the appropriate resources? Primary care, what is the right number? Is it the ratio that equals the state? Is it the ratio that ensures that somebody doesn't have to wait more than 24 or 48 hours to be seen? And with this, it's really important information. And I don't mean to
This
be
is really
going
good
on
feedback for us as we're
Oh.
doing this strategic planning with the community, that this is an area that you all are seeing as something we should definitely focus on more of our attention.
I believe objective numbers matter. And if we're going to prioritize something, and if you're going to put on a slide, then how are we going to resource those priorities? I don't know. It's good information. It is, but it's like, so what? Why are you telling us this? What do you want us to do about it? How do you want us to resource it? Where do you want the funding either to go to, and then let's figure out together how to receive that funding?
Well, you're doing exactly what we want you to do, which is to give us your thoughts about what we should make our
got
strategic
plenty of
priorities.
thoughts.
So that's
And
perfect.
I will associate myself with Commissioner Rothstein's comments and also Commissioner Gordon's, and speaking to the heart of the data itself. I understand that it's an optional survey to complete. And so I guess my question would be, first of all, why is it optional? But I guess that's more of a less of a point than, if somebody does opt out, do we provide a place or the ability for them to explain why they're opting out? Because if we can understand why they're opting out, for example, it might be part of the stigma associated with it. If we can figure out why they're opting out, then we can target the reasons why they're opting out and use that to help fight the stigma that surrounds it.
It's to give them 15 more minutes of playtime in the classroom.
But I think it's two-edged. If you don't let them opt out, how do you cannot make them answer honestly.
Right.
Correct.
So which is better, that they lie or they
No,
opt out?
Well, right,
I
but
know.
if they explain why they're opting out.
Yeah.
But there, again, putting yourself in the public schools and, the students,
God bless you.
Bless you.
they do great, but there are students that will say, hey, this is free time, and take advantage of that free time and get on their phone and do whatever. That's the reality, and I'm not dissing the public schools. They're awesome, but,
Yeah.
that's, we just have to figure it out. Maybe, it is doing this in the public school system or in the school system, but maybe it's also doing it in, the churches or the libraries or any other voluntary space in the parks, I don't know, wherever kids are, in the Boy Scouts or Cub Scouts, just, not making it, mandatory stuff because we want separation. But if that's something they want to do, then we should look at all tools because we're obviously not looking at enough of the tools that are out there identifying the community. And therefore, it all comes back to money. It all goes back to resources. Are we resourcing the needed requirements? And if we say they're a priority, then that means we resource them.
Right.
And I don't think we are. I think, and we can go into the grandest scales, and talk about, the medical schools not pumping out enough psychiatrists and all that kind of fun stuff. But again, we can't boil the ocean. What can we do in our community? And I just don't think we're doing enough collectively. And we got to figure it out.
Well, I would just ask one other quick question in reference to that. So they can opt out. Do we know how many individuals or percentage-wise who is opting out? So we don't know if it's a class of, say, 20 kids, did 5 opt out? So statistically, these numbers, while they're helpful, to your point,
Right.
We could have a situation where, suicidal thoughts, we're thinking it's X, and it could be significantly higher because they're not answering the question.
Yeah, and that's was the response is no. You really don't have a.
Because I think it'd be at least helpful, I guess is the word I'll use, is if you could at least gain that metric.
I was just asking Amy.
Okay.
That it's part CDC and it's done through MSDE, so it's a collaboration.
Yeah.
Sure.
So we, trying to get that data is figuring out who has that data.
Understood.
If it's MSDE and they're not willing to share it beyond that, you might be able to find that out. I can look
I
into
couldn't even
that.
find out which schools were. I mean, this is, since you're interested in methodology, it's a random number of schools, random classes. It's, just a percentage of students that even take it.
Yeah.
That are even offered it.
Correct.
I mean, understanding our role is full-time representation for the county to resource the priorities of the county. And if any one of us, thinks differently, then we're not doing our job appropriately. It is not a part-time, 1 day a week. It is a full-time, 100% representation of the county on how to resource the priorities. If these are the priorities that you're laying out in front of us, which I've shared this, absolutely agree with, then how do we get to a better number, a better solution to prioritize and then resource? So I hope that helps some.
It definitely is very helpful. I don't know how much time I have left, but I have a couple more. Slide,
You have
okay.
one more?
Just a couple, I'll just go quick slides. I just wanted to let you know, so this is the suicide deaths by year, which you can see in 2022 is about half the rate in 2014, so that's good. But we definitely keep a close eye on that. This is also a SHIP priority. Thank you for what you said, by the way. There's a couple things I wanted to cover here.
Yeah.
This is just suicide fatalities affect all ages, primarily males. These are just methods. So males primarily use firearms. And suicide fatalities, these are just a couple we can skip. As you know, we've talked about several times, non-fatal overdoses have been decreasing, which we're very excited to see. These are just some substance use, which also kind of goes hand in hand, as we know, as part of behavioral health. So substance use in high school students, this is the same survey again. Cigarette and alcohol use were significantly higher in Carroll County versus Maryland high school students. However, in middle school students, they were significantly lower except for alcohol, I believe. So that's good news. I did want to mention this is again the same survey. These are self-identified LGBTQ students, and they have higher risks of many of these risk behaviors and substance use. And other unhealthy outcomes than their peers, including a substantially greater risk of dating violence, bullying, and suicide attempts. And we've talked about the adverse childhood experiences, or ACEs. About 75% of kids in Carroll County report at least one ACE, and about 50% report two or more. And these ACEs, these are some examples of some of the ACEs, and the most common, the ACEs that are more common in Carroll than in Maryland are household substance misuse and household mental illness. And the rest of it is just some partner surveys that that you can certainly browse at your leisure, including just to let you know that we do, as part of our strategic planning process, we do survey community partners. We had about 60 survey responses from a variety of partner agencies. We survey community members as well. We had about 223 responses. So we take that into account as we're developing our priorities and setting our agendas. We did talk to them about barriers, and about 36% said their biggest barriers, they didn't know about the services, so that's definitely an area where we need to work. Other common barriers were hours and same-day services, transportation, but also stigma and embarrassment. We definitely noticed that. And then there were just suggestions for things we can do to improve our services, which were primarily increasing awareness of our services, access to services, communication, expanding services for underserved communities, improving customer service and partnerships, and offering more vaccine clinics. And then the biggest health-related issues in Carroll County, this really tracks with everything we've been talking about, including the plans that we talked about at the very beginning. So substance abuse and drug-related issues, mental health issues, general health, nutrition and obesity and healthy living, homelessness and housing, poverty and social determinants of health, access, vaccine issues and misinformation, food insecurity, and education. And this is just a very impossible to read slide, just showing that the state, who also did a very similar survey in 2023 as part of their state health improvement plan, just so you know, there were 108 Carroll County voices included in that report, and they had very similar responses, that their top issues of concern in Carroll County were mental health, access to health care, affordable housing, chronic disease, and substance use. So these are all the things that we're using. Well, that's a highlight of the things that we're using to create our strategic plan and our strategic priorities. And so I don't know how much time we have left. I don't have a timekeeper, but we can talk now. We can talk later. We can send out surveys. But we just wanted to hear from you what you found most interesting. We already have to some extent, so thank you for your comments. But are there other issues that are important to you and your constituents, things that you need more information on, things that you want to see us prioritize in the years moving forward?
I'd like to recognize something Commissioner Vigliotti said earlier in his priority carol about the COAD yesterday and the concern about the Partnership for Healthier Carroll County. So the LHIC, the Local Health Improvement Coalition, is actually a responsibility of the Health Department. The hospital and the Health Department formed the partnership to not only do the community health needs assessment activities, but to plan the community health improvement priorities and the activities. So we will be continuing those in partnership with the hospital. And in fact, we are in talks with all of those groups that are currently still existing. And we're also, to Commissioner Rothstein's point, looking to reinstate the behavioral health work group, which became all these little work groups like the CARE, the Carroll Area Resiliency Efforts, and I can't remember all of them, but there were all these little offshoots of substance use and mental health that kind of separated off of a larger committee. And what the hospital and the health department have looked at is that we really need that larger committee. But that was one of the takeaways from the hospital and the health department as we were dissolving, is that we have to make sure that we're capturing access to health care, the seniors, that we're capturing all of these priorities that are in our plan that we're aware of, and that we're continuing to work together on those. And we will continue to work on the community health needs assessment with them, because it's important to our efforts. We can't just look at the state data. We can't just look at little pieces we're able to pull here and there. We need to really look and dig into our community and find out what's going on.
And obviously, if there's anything that you need from us in terms of even promoting surveys or or communicating that services are still being, whatever the case is, please do let us know, because we certainly do have something of a platform here from which to be able to express support or to advocate for particular things. So.
And you've been very helpful with a lot of the advertisements that you've put on the station when we're doing take back days or we're doing other events or health fairs. I think that's driving more, and we've been really partnering and coordinating with other efforts. so that it's not just like that's the only activity, and there's a health fair or there's food giveaway, and then we're also doing these activities to provide more opportunities for people to avail themselves.
One other thing we're doing, we're starting a Here For You campaign, the idea of which we want to express to people. We want to talk more about our services and what's available for everybody. We have something for everybody at the health department, so you'll see that come out, and I'll make sure that that gets sent to you as well, so you can share the ones that you think that are most important for your area. But hopefully highlighting for every person, there's something that we can help you with at the health department.
Thank you. Thank you very much.
Yeah, I want to thank you for putting this together. I thought this was particularly helpful. It's a great snapshot, if you will, of
Photo album.
what's going on within the county. And if there was, I imagine it probably should be required reading, really, for a lot of our nonprofits and people within our own county government to really get a sense of what some of the main issues are. If I had to point to anything, I've mentioned before, it's always going to be, if there's room for improvement, and this is not just with the health department, but always that issue of access and making sure people understand how to get help they need or to tap into resources. I think that's still probably always going to be the most difficult thing. But I get my share of, text messages and phone calls myself. Who do I call about this? I've got an issue here. Not to say that's a deficiency within the county government, but I think it's always going to be a challenge. Just making sure people know, who to call or who to send that email to or the website to go to.
Yes, that's very true. Very good point. Anything else you want to mention to us now?
Anything else?
Just want to say thank you for the information.
Thank you for
And-
for giving us
and
the
you
time to
were
present it.
A lot of information, and you did it quickly. So thank you. It's two-edged.
We made an effort to get it to you
Yes.
way ahead of time so that you could actually look at it and
Yep.
not try to absorb while we were going through it. So I think that made a difference this time.
Oh, yes, yes.
So we will try in the future, when we have larger presentations like this, to make sure you have it in advance. You can review it. If you have anything you want to talk about or send to us beforehand to highlight, we can do that too.
Yes, of course, feel free. If something strikes you all of a sudden, or you find this on your desk underneath some other papers and something occurs to you, please reach out to us. Let us know. If something, constituent mentions something that's covered here that you think is important for us to know, please let us know. The other thing I wanted to mention is another effort that we'll be making in addition to that Here For You campaign is to really share more data. Of course, the partnership has that data dashboard that will be moving. The hospital will be taking care of that for the time being, but we're really looking for a way to get more local data on our website, local and state, connected to state data as well. So that's something we'll be working on over the summer as well, to really make sure that folks have access to local data.
And there's a number of dashboards the state has put up recently. I will make sure you have that information, because you can drill down to Carroll County specific information, whether it's on an overdose or whether it's on, I think there's one on maternal child health also, that you can drill down by county and see the data. So I'll make sure that we highlight all of those and get them to you.
Thank you very much.
Thank you so much.
Is there a motion to adjourn the Board of Health meeting?
So moved.
Second?
I have a motion, a second. Any further conversation? All those in favor?
Aye.
Opposed? Thank you very much.
Thank you.
Thank you so much.
And so we will reconvene open session, and
Do we need a point, or wait, sorry, do we need a vote to go back into, to reconvene?
I don't think if we recess, we don't need a vote to unrecess, do we?
Just wanted to make sure.
I always liked recess in school. I remember.
It's over now.
So now we have Fire and EMS talking about their medical director. Who, by the way, is awesome.
Very much so.
Good morning again. Excuse me. The Office of Procurement, cooperation with the Department of Fire EMS, requests your approval to contract with Johns Hopkins School of Medicine Department of Emergency Medicine as an independent contractor who will serve as the medical director for the Carroll County's EMS operations. The Department of Fire EMS is requesting to an increase in working hours for the medical director, bringing this year's amount not to exceed $149,100. The funds are approved in the fiscal year 26 budget.
Under the Maryland Code of Regulations, what's known as Title 30, An emergency medical services program in the state of Maryland is required to have a medical director. For the last 3 years, we've contracted through the Johns Hopkins Medical Institution, and we have Dr. Stephanie Kemp assigned to us. Dr. Kemp spends way beyond her hours. She provides clinical education. She provides quality assurance, and again, being required under the law, she provides a multitude of services. She also responds to incident scenes, and her leadership has really taken our agency forward, as you're aware, with many initiatives. When Dr. Kemp isn't available, this contract also gives us access to additional physicians within the Johns Hopkins system.
I'll move the Board of Commissioners approve contracting of a medical director with Johns Hopkins School of Medicine, Department of Emergency Medicine, in the estimated annual amount, $149,100.
Second.
I have a motion and seconds. Any further discussion or, and that was going to be my question, and I think you just answered it, but really, we are contracting with Johns Hopkins.
Yes.
That's who we're getting now, but if she would go away, we'd immediately have somebody else.
Yes, yes. We get a multitude of doctors from their whole program, and it also gives us access to their clinical sites within their system.
Okay. All those in favor?
Aye.
Opposed? Thank you.
Thank you.
Now, continuing with EMS, approval to purchase medical supplies and accessories.
The Office of Procurement and Cooperation in the Department of Fire and EMS requests your approval to purchase medical supplies and accessories from Boundary Medical in the amount of $36,565.57. This purchase will be made through a Fairfax County, Virginia contract that was competitively bid. This amount is approved in the fiscal year 25 budget.
Yeah, these are currently budgeted medical supplies and includes a wide array of equipment, primarily disposable equipment, to assist us in providing patient care at different levels.
Motion to approve the purchase for medical supplies and accessories from Bound Tree Medical in the amount of $36,565.57.
Second.
I have a motion and a second. Any discussion or questions? All those in favor?
Aye.
Opposed? Thank you.
Thank you.
Thank you.
job. And now the Comptroller's Office is going to talk about approval to change for CC Visa length of service award program.
Good morning to you both.
Good morning, Commissioners. Here today, Mark Devilbus. He is the chair of LOSAP, which is the Length of Service Award Program, so we get that whole nice long title out there. It was established by Carroll County Volunteer Firemen's Association in cooperation with the county government, Carroll County Commissioners, and it is for active members of the Carroll County Volunteer Fire Companies. And active member is defined as a member of a Carroll County Volunteer Fire Company department who attains points of uncompensated volunteer service during the year. Any volunteer who has completed 25 years of certified active service and has reached the age of 60 shall receive a payment. Currently, it's $175 a month for life. Payments begin on the first day of January, and if the qualifying member's birthday and the 25 years of service is reached between January 1st and June 30th of that year, the payments would currently begin the first day of July. If the qualifying member's birthday is between, is that correct? It should be January, sorry. On January, and if the qualifying member's birthday is between July 1st and December 31st of that year, then they would start on July. So they're kind of getting paid in advance before their birthday actually occurs currently. They also receive an additional $8 per month as each year they add on to their active volunteer service. So the comptroller, in cooperation with CC Visa, who has approved this, as well as the LoSAP chair, would like to change the benefit to begin at the beginning of each month when the member receives the 25 years of service and reaches the 60-year age of 60. Basically, if you would turn 60 in February, your payments would start in February instead of January. If the change is approved and effective for July 1st, the LoSAP fund would have a cost savings of $1,682 for the remainder of this calendar year 25, and then the cost savings for 2026 calendar year would be $11,411 based on the current eligibility that we have now. And I will offer any comments, if Mark has any comments or...
Aside from the cost savings that Ms. Hobbs mentioned there, it was just on our end of processing this, it was provided confusion or created some confusion there. You're looking at people's, when they turn 60 for the next 6 months and then processing those payments at the beginning of that 6 months. I wanted to just clean it up, and when you're 60, the month that you turn 60, that's the month that you become a new recipient.
I respect and appreciate that move for reform. I really do. I'll make a motion to approve the change to the length of service award program payment schedule to a monthly start date for eligible members in place of the semi-annual start date for eligible members.
Second.
I have a motion and a second. Any discussion or comments?
So, yeah, thanks, Mark, for explaining that the way you did. This affects a lot of people. It's not a large dollar amount, but it affects a lot of people. So in the briefing papers, it mentioned CC Visa took a look at this, obviously voted on it, approved the change, which really in effect just kind of makes things simpler.
Yes, sir.
Okay.
Yeah,
All right.
so the changes were drafted at a LoSAP committee meeting, probably the end of last summer. I presented them to the CC Visa meeting, I believe, in November, and they were adopted, they're approved there.
Okay, all right, great, thank you.
Any more discussion? All those in favor?
Aye.
Aye.
Opposed? Thank you.
Thank you.
You're welcome.
Now, Public Works, emergency generator rental for the Freedom District Water Treatment Plant.
Good morning, gentlemen.
Morning to you, gentlemen.
Good morning.
Morning. Morning.
The Office of Procurement, in cooperation with the Bureau of Utilities, requests Board of Commissioners approval to award a contract for the rental of an emergency generator for the Freedom District Water Treatment Plant in Commissioner District 5 to Universal Utilities of Manchester, Maryland, in the amount of $29,455. This purchase will be made via term contract. The proposed amount is within the adopted budget.
Gentlemen, while waiting for the delivery and installation of two replacement parts, the Freedom District Water Treatment Plant's 600 kilowatt backup generator was offline for a 7-week period from mid-March until late April. To maintain operational readiness at the facility, an emergency generator was required to be rented and connected to the plant's power system. Even though the water plant's backup generator is only about halfway through its anticipated 25-year service life, spare parts for the generator are not routinely kept in stock by vendors. Replacement parts often need to be ordered, and these typically have lead times associated with them. The cost for this item includes 7 weeks of emergency generator rental and the associated labor to connect it into the plant's power grid. Any questions for me?
So, do we have a new generator on order?
We do not. It's about 12 years old now. We anticipate it'll last for about 25 years. It's a very expensive generator, probably on the order of $200,000.
But we're getting parts for it.
We are getting parts for it.
When are the parts coming in?
They have arrived since.
They have arrived since.
Yes,
This rental has already occurred?
it has occurred. I'm in a delicate spot with needing the rental generator when the backup generator is out of service, and the amount of time that would take me to come to the board scheduling for this rental services.
How long has this generator been on hand?
It's been on hand for 7 weeks.
When is it expected to go away? and the
It-
the generator be fixed.
It's still on site, however, it has been taken off the
Taken
power.
off power.
Our generator is back in service at this point.
I mean, I feel like something a little backwards here. Like, we should be approving the rental before the rental is on hand, but you needed to get the rental on hand because of the
Emergency.
timeliness.
Right, it was an emergency, and so
Right.
yeah, so,
Okay.
yes, you're right. This is not the normal course of things, but
Yeah.
then emergencies don't allow for the normal
No,
course of
and,
things.
no, I appreciate it, and quality of life is to maintain the water, you know, at the Freedom Treatment Plant. So, I mean, I get that, and that's why we have you to do the things you do, and, you know, us to be able to approve it. We've used Universal Utilities before.
We have, they are a term contractor with us, and they serve us very well. And just for you to be aware, again, this is a very large generator. It's not your typical size that we would use for a routinely sized pumping station. It's a room-sized
Yeah,
generator.
no, I get you. I come from a world where we use big things like that. Sugar, there was some, was this sole source? I mean, it's term contract.
Term contract,
So-
an emergency, so is, they have it,
They have
let's
it.
get
Yeah.
it here.
That's the way it works, okay. Yeah, I appreciate the dialogue. I move the Board of Commissioners award a contract for the rental of an emergency generator for the Freedom District Water Treatment Plant to Universal Utilities in the amount of $29,455.
Second.
I have a motion, a second. Any further discussion? All those in favor?
Aye.
Opposed? Thank you. And now, request for additional work associated with replacement of water service valve bolts. Valve bolts at Freedom District, also down there.
Yeah.
The Office of Procurement, in cooperation with the Bureau of Utilities, requests Board of Commissioners approval of a change order to HTI Contractors in the amount of $23,390 for additional work associated with the recently awarded contract for the replacement of water service valve bolts on Compton Lane, Guilford Road, Samara Circle, and Shortleaf Court within the Freedom District service area in Commissioner District 5. This change order exceeds the 10% of the original contract and per resolution number 1162-2022 delegation of authority that requires the board's approval to spend these additional funds. The change order amount is within the adopted budget and capital project.
Gentlemen, the current contract for the replacement of water service valve bolts within the Freedom District was awarded to HTI Contractors last October for 103 various locations within the service area. And as I explained at that point in time, this continues the ongoing work that we have with the unbelievable installation of cast iron bolts on our valve assemblies. So they are being upgraded to stainless steel bolts. The problem that we're having is the cast iron bolts snap very readily as time goes by. So with this current contract, as work began, it was discovered that fill conditions for 7 of the locations were very different from what is shown on the as-built drawings. The valves at 6 of these locations were at deeper elevations than shown on the drawings. This required additional excavation, shoring, stone backfill, and crew time. And the valve at the 7th area was encased in floatable fill and required more crew time and equipment to break apart the floatable fill and excavate it. So rather than temporarily halting the work and risking the valve bolt failures as they were exposed, BOU staff instructed the contractor to move forward with the additional work needed to replace the water service valve bolts at these locations. And as Ryan explained, this change order is for those additional services. And as I explained briefly last week with the water service lateral item, we do have a better approach that we have in place now for the accuracy of as-built drawings. So had these new installations been completed within the last 5 years or so, our mechanism currently in place would have caught the additional depth of the valve bolts and corrected those.
From start to finish, when you break ground to do the work, is it a one-day project? Is it a, multi-day
At the
project?
most, it'll be 2 days. We do still plate several of these locations overnight. But the cast iron bolts are never left exposed. They are replaced.
Would the Board of Commissioners approve change order for additional work associated with the replacement of water service valve bolts within the Freedom District to HTI contractors in the amount of $23,390?
Second.
I have a motion, a second. Any further discussion or questions? All those in favor?
Aye.
Opposed? Thank you.
Thank you.
Now, Bureau of Facilities requests approval to encumber funds for energy management control services for various county-owned buildings.
Morning, Commissioners.
Morning.
The Office of Procurement, in cooperation with the Bureau of Facilities, requests your approval to encumber funds for energy management control services for various county-owned buildings to Johnson Controls per term contract 12143 in the amount of $612,900, which is $458,372 for county buildings and $154,528 for Carroll Community College. This will encumber funds for fiscal year '26.
Commissioners, Johnson Controls has been supplementing the Bureau of Facilities Preventive Maintenance Program for over 20 years, providing essential support to all Carroll County government infrastructure. The expert maintenance and service in critical large-scale assets such as chillers, boilers, cooling towers, heating and water pumps, VAVs, all the controls over the 26 county buildings, 6 libraries, and also including Carroll Community College. This contract enhances the efficiency, ensures dependable functionality of all the equipment, and expands the lifespan of the equipment, routine maintenance, proper maintenance, longevity of the equipment. At the end of the day, cost savings on energy side of things and just routine, not planned maintenance, and we can really forecast these large set scale items to be budgeted for and replaced on our time and not their time.
Does this ever come up for competition with other vendors that are,
So,
there's others that are, Johnson Controls is one.
Is Johnson Controls, it's a proprietary, I wouldn't say software, but equipment.
Yep.
It ain't like we can call Siemens in to work on Johnson Controls or vice versa. 20-some years ago, the county kind of went into the lane of the JCI, Johnson Controls Energy Management Contract, and we've been in that lane ever since. To change lanes now would be a crazy amount of money and a large-scale project, and you're still going to get a system like we have now. You're not going to gain any benefits.
Yeah. I'd like to have a further conversation sometime. Just understanding, because I know there's others that are out there, not questioning Johnson Controls.
Sure.
But I do know that it's a long period of time that you're going to maintain a contract for energy.
Sure.
So,
And just a note on this one, I did pull up the term contract, and this term contract was awarded, I want to say it was in 2022, and it was a 10-year contract awarded then. So it was unfortunately before my time, so I don't know how it
No, that's all
went out.
good, but
But it
I
was
appreciate that,
gone out
10-year.
again recently.
Yep. Okay. Thanks. I'm done.
Motion to approve the encumbrance of funds for the Energy Management Control Service at Johnson Controls per term contract 12143 in the amount of $612,900.
Second.
I have a motion and a second. Any further discussion or questions? All those in favor?
Aye.
Opposed? Thank you.
If you were going to make the motion.
And now, approval to purchase Series 300 manual transfer switch.
The Office of Procurement, in cooperation with the Bureau of Facilities, requests your approval toward the purchase and installation of one ASCO Series 300 manual transfer switch. This is a turnkey project for Universal Utilities in the amount of $31,500. This unit will be installed at the county office building on the exterior of the building. Universal Utilities is a current term contractor with Carroll County. This amount is approved in fiscal year '25.
So, Commissioners, during the last power outage, the primary generator here on site, one of the components failed. As a result, portable generator was mobilized, and an industrial electrician was needed to connect the main electrical system, which resulted in some delays. The generator docking station that we're providing here to be installed at the county office building provides facilities a fast, seamless connection between a portable generator and the building's electrical system to minimize the downtime and any impacts to the county or county IT infrastructure. The docking station allows for easy integration to the temporary generator unit as well. If we're working on the current generator in-house, we can bring in our temporary, which we have out at the maintenance center, hook it into this docking station within, a few, I wouldn't say minutes, but within an hour or so, getting everything on site, we would have backup power to the building. And this is just a really quick and easy, safe, seamless connection. Instead of running wires in and hooking things up to the lugs, this is all cam lock, quick connects, fittings.
Motion to approve the purchase and installation of one ASCO Series 300 manual transfer switch for the county office building to Universal Utilities in the amount of $31,500.
Second.
I have a motion and a second. Universal Utilities is relatively local and one of the term contractors. How long have you been working with them, do you?
I've been working with them for over 6 years. This is their second term for the preventive maintenance on all generators throughout the county, whether it's within facilities, within utilities, with all the tower sites. They come out annually to do inspections. They come out quarterly to do inspections. And then also they're there for emergency repairs as well.
They actually hold 4 different term contracts with the county for different services that have been bid out.
Okay, thank you. Any further questions, discussion? All those in favor?
Aye.
Opposed? Thank you.
Thank you.
Now, computer room, UPS replacement. Good
Morning, gentlemen.
Morning, Commissioners.
All right. The Office of Procurement, in cooperation with the Department of Technology Services, requests your approval to purchase the replacement of the computer room UPS from Graybar in the amount of $276,985.99. This purchase will be made via Omnia Partners Cooperative Contract EV 2370 that was competitively bid. This amount is approved in the fiscal year 25 adopted budget.
Morning. Just to give you a quick little background on what's going on, believe it or not, it's been almost 50 years since that part of the building has been built. That's when the computer room was actually put in downstairs. We've done no major upgrades to anything in that time period. The UPS that we're currently using is between 25 and 30 years old, and we had some problems with it when we had some power issues over the last several months, so we do need to go through and upgrade that. We did have a study done because, as you can imagine, over 50 years, our power needs have changed dramatically in there. We went from one small mini computer to an HP 3000, and now literally we have hundreds of virtual servers and routers and switches and all that kind of stuff in the computer room. So we had them come in and do a study so that we would know what the right size UPS would be for that, and they did that for us, and now we're asking to actually have the work done.
And remind me what UPS stands for?
Uninterruptible power supply.
Awesome.
So what happens is that there is a little...
Postal Service.
Right. What happens, Commissioners, is there's a little bit of lag between electric going out and the backup generator kicking in. What this UPS does is it keeps that equipment up and running for that time frame. So it would be very, very dangerous if any of that equipment would just completely shut down. We had problems in the past trying to get it back up because things get locked and it becomes a real mess. So this is definitely something that we need to be doing and hasn't been done for a long, long time.
What's the lead time in getting this?
Lead time is 12 to 15 weeks.
Okay.
So, and then it's about 3 days
For the installation.
for the installation.
So we're looking at like September, October
Most likely, yes.
for having this switched out.
Motion to approve the purchase for the replacement of the computer room UPS from Graybar in the amount of $276,985.99.
Second.
I have a motion and a second. Any further discussion or questions? All those in favor?
Aye.
Opposed? Thank you.
Thank you.
Thank you.
Do we have any public comment here or on the phone?
I have one on the phone, if you'd like to take that one first.
Yes, thank you.
Yes, caller, if you could use *6 to unmute, you'll have 3 minutes. Please identify yourself. Thank you.
Are you there?
She is unmuted.
Okay.
I can see that she's unmuted. I'm not hearing her.
Hello?
There she is. Okay, we can hear you.
Hi. Oh, wonderful. Okay. Good morning, commissioners. Thank you for your consistent position on protecting farmland from commercial solar development. As a commission, I appreciate that you specifically opposed SB 931, which takes zoning control away from local counties and makes it much easier to install large solar facilities on farmland, including land and preservation. Like Carroll, other counties across the state, large ones like Montgomery County, and the smaller rural counties on the Eastern Shore joined together to oppose this bill. But that did not keep the General Assembly from passing it, nor Governor Moore from signing this governmental overreach into law. They chose the solar industry at the expense of our largest economic driver, which of course is agriculture. Hello?
Yes.
Go ahead.
A group, okay, I'm still going. Okay. A group on the shores started a referendum drive to put this measure on the 2026 ballot. I found out about this yesterday. The folks on the shore have been working on this longer. In order for people to find out more about what some of us in Carroll County are doing, I've put together a Facebook page, SB 931 Petition Drive. That's SB 931 Petition Drive. On that page right now, you'll find information about the statewide effort led by the Farmers Alliance for Rural Maryland. The biggest wrinkle is we need to get our first tranche of signatures in by Monday. So if people can go to the Facebook page, SB 931 Petition Drive, I will have more information about what some of us are doing in Carroll County to collect signatures and then drive them to the shore on Sunday night. And I'm not sure if I identified myself, but this is Sally Taylor. God bless you all. Thank you.
God bless you too. Thank you.
Thank you.
Thank you.
That's all I have.
Okay, thank you. Administrative session opened. Any commissioners have any items they want to bring up, discuss?
No, sir.
Agenda.
Hello, Wanda. How are you today?
Good. How's everyone?
Doing well, thank you.
Okay, Monday, June 2nd, Man Valley High School graduation, Commissioner Kyler. Century High School graduation, Commissioner Rothstein. Commissioner Gordon's Chamber of Commerce breakfast, and he will be there, obviously, and Commissioner Rothstein and I are coming to listen to you.
It'll be a really short breakfast if he's not.
Incredibly.
Yeah, yeah. Francis Scott Key High School graduation, and Commissioner Vigliotti will be there. South Carroll High School graduation, Commissioner Guerin will be there. Do you have any children graduating this year?
I do. My youngest daughter will be graduating
Great.
on Tuesday.
On Wednesday, Liberty High School graduation, Commissioner Rothstein. Overdose Prevention Policy Group, Commissioner Guerin. Winters Mill High School graduation, Commissioner Gordon, and I'm also going to that. Thursday, June the 5th, 8 a.m. Closed admin, 9 a.m. open session. Priorities Carol, which I'll try not to skip. The 81st anniversary of D-Day landing by the 29th Infantry Division. It's always fun to hear from them. World Elder Abuse Awareness Day, a proclamation, and Maryland Association of Counties, MACO, will join us to give a presentation. Century High School Stormwater Management Retrofit, PFAS Phase 1 Groundwater Remedial Investigation, Third-Party Claims Admin Services, Hazardous Materials and Emergency Preparedness Grant Application, Maintenance Support and Upkeep for the Central Maryland Area Radio Communications Network, Annual Maintenance for Support and Lifecycle Management, Recovered Materials Operation and Transfer, Waste Transfer Disposal through Northeast Maryland Waste Disposal Authority, Processing and Recycling of Recovered Materials through Northeast Maryland Waste Disposal Authority, Services at the Recycling Center, Household Hazardous Waste Services, and encumbrance for funds for pipelining on Enterprise Street, funds for blacktop chip seal repairs, shotcrete linings on Placid Drive, shotcrete linings on Owings Road, shotcrete linings Lees Mill Road, public comment, admin open, agenda review, Westminster High School graduation, Commissioner Gordon, Solar Sunshine PSC hearing, which will be virtual. I've asked the host, and Commissioner Guerin's gonna comment. On Friday, Carroll County Realtors Legislation Panel at Piney Branch Golf Course, Commissioner Kyler, Fort Meade Community Covenant Signing, Commissioner Rothstein, Gerstel Academy Commencements Exercise, and we currently have no one attending that. Saturday, June 7th, no activities, and Commissioner Vigliotti does the podcast. Good for that week. Monday, June the 9th, no activities. On Tuesday, June the 10th, Special Olympics Law Enforcement Torch Trek, Commissioner Gordon, and I will also...
Yeah. I think I'll be attending that as well.
So Gordon's, Kyler, and Ross.
Yep.
Okay, thanks.
Leadership Carol Commencement Class of 2025 shows no one attending currently. 7 p.m. is the Ag Center Board Meeting, Commissioner Kyler. On Wednesday, Farm Museum Board Meeting, Commissioner Vigliotti. 1:30, Carroll County Sheriff's Office Correctional Academy class graduation, Commissioner Kyler. Governor's Workforce Development Board, Commissioner Rothstein. Board of Education meeting, shows none of us attending. Annual Farm Museum Advisory Board picnic. I'll have to check. I think I said I was going to that.
Yeah, I think
but
that's on my
let me
calendar
double-
as
I think so
well.
too. Wanda, if you could add me.
Okay.
Thank you.
And I'm gonna check with Vivian, who's next door to you. So I'll get you an answer. Mako Spring Board Retreat, Commissioner Rothstein on Thursday. And that means you'll do our meetings virtual or not at all?
I have no idea. I have no idea. I'll let you know.
Yeah, okay. But it looks like you're booked.
Yeah.
8 a.m. Closed admin, 9 a.m. open session, priority Carol. Proposed use for not in Carroll funding. Replacement of Upper Beckleysville Road Bridge. Pool demolition at Carroll County Regional Airport. one of the properties acquired. Public comment, agenda review, open admin. At 6 PM is the MML meeting at, in Mount Airy of Carroll and Frederick Counties MML participants, Commissioner Kyler.
If you could put me down for that as well, please.
And on Friday, Mako Spring Board Retreat, still Commissioner Rothstein, 2 PM, Volunteer Appreciation Recognition Ceremony at the Farm Museum, Commissioner Kyler. 9 AM, Every Step Counts, which is a great, I think they do it 2 locations in the state. They used to do it at Man Valley, and they wanted to change to a more of a park place where they could more safely walk, and they're doing it at Dutterer Family Park, and I'm going to that. Fort Meade Army's 250th birthday ball, to be determined, and Commissioner Kyler does the podcast. Is it written yet?
I'm
Wanda, if
going
you-
to start off by paying tribute to you.
Sounds frightening.
Yeah.
Wanda, could you,
Any changes
That's
to
elder
the,
abuse.
could you add me to the MML meeting and also the volunteer appreciation ceremony for the Farm Museum? Thank you.
okay, I guess we're ready for a motion to adjourn.
So moved.
Second?
I have a motion and a second. All those in favor?
Aye.
Opposed? Thank you.